Have you ever gone to bed feeling like you ate a perfectly healthy dinner, only to wake up with higher blood sugar, less energy, and stronger cravings the next morning? If you have diabetes, prediabetes, insulin resistance, or you're simply trying to lose stubborn belly fat, what I'm about to share may completely change the way you think about vegetables. Because here's something that surprises many people. Not all vegetables behave the same way inside your body. Some vegetables actually help stabilize blood sugar. Others can cause your glucose to rise much faster than most people realize, especially when they're eaten at dinner. And here's what's even more interesting. It's often not the vegetable itself that's the biggest problem. It's the amount you eat, how it's cooked, what you eat it with, and even what time of day you consume it. That's where many people unknowingly sabotage their metabolism. Today we're going to focus on one vegetable that endocrinologists frequently discuss with patients who struggle with elevated fasting glucose and insulin resistance. It's probably sitting in your kitchen right now. The goal of this video isn't to scare you away from healthy foods. In fact, this vegetable contains valuable nutrients. But understanding how your body processes it can help you make smarter choices that support better blood sugar control, healthier weight, more consistent energy, and even healthier aging. Here's what's really going on inside your body. Every time you eat carbohydrates, your digestive system breaks them down into glucose. Your pancreas responds by releasing insulin, the hormone responsible for moving that glucose out of your bloodstream and into your cells. When this system works efficiently, your blood sugar rises gently and returns to normal. But when insulin resistance develops, your cells stop responding as effectively. The pancreas compensates by producing more insulin, and over time, both insulin and blood sugar can remain elevated longer than they should. That's when nighttime meals become especially important. While you're sleeping, your liver continues regulating blood sugar. If you've consumed a meal that causes a large glucose response late in the evening, your body may spend much of the night trying to restore balance instead of focusing on repair and recovery. What the research consistently shows is that meal composition, carbohydrate quality, fiber intake, and portion size often matter more than simply counting calories. Foods with a higher glycemic impact, such as large servings of certain starchy vegetables, can produce larger post-meal glucose rises, while pairing carbohydrates with protein and fiber helps blunt those spikes. In today's video, I'll explain exactly why this happens, why many people misunderstand this vegetable, how cooking methods completely change its effect on your metabolism, and most importantly, the simple strategies that allow you to enjoy it without sabotaging your blood sugar. And if you're serious about improving your metabolism naturally through science instead of fad diets, consider subscribing. Every week, I break down complex physiology into practical strategies you can actually use in everyday life. Let's begin by uncovering the biggest misconception about vegetables and blood sugar. Many people hear the advice to eat more vegetables and assume that every vegetable affects the body in roughly the same way. It's understandable why. Vegetables are generally associated with health, longevity, weight management, and disease prevention. But from an endocrinologist perspective, vegetables fall into very different metabolic categories. Here's what's really going on inside your body. Imagine your digestive system as a factory. Every food you eat arrives on a conveyor belt to be processed into usable fuel. Leafy greens like spinach, kale, lettuce, broccoli, asparagus, and cauliflower move through that factory slowly. They're rich in fiber, relatively low in digestible carbohydrates, and require more work for your body to break down. The result is a gradual release of glucose into the bloodstream, keeping insulin demands relatively low. Now imagine placing a large baked potato on that same conveyor belt. Although it's technically a vegetable, it's metabolically much closer to a dense carbohydrate source because most of its calories come from starch. As digestion begins, enzymes in your saliva and small intestine rapidly break those starch molecules into glucose. That glucose enters the bloodstream, prompting your pancreas to release insulin so your cells can absorb and use the sugar for energy. For someone who is young, active, and highly insulin sensitive, this process may happen efficiently. Blood sugar rises moderately, insulin does its job, and glucose returns to normal without much difficulty. But that's not the reality for millions of adults today. Many people have some degree of insulin resistance without realizing it. Their muscle and liver cells no longer respond to insulin as effectively. It's like trying to unlock a door with a key that's become worn down. The pancreas compensates by producing more insulin, but glucose remains elevated for longer than it should. This is why the same potato can have very different effects in different people. One person experiences only a modest increase in blood sugar. Another may see a sharp spike, followed by an extended period of elevated glucose. Research consistently shows that individual responses to carbohydrate-rich foods vary widely, depending on insulin sensitivity, body composition, physical activity, sleep quality, stress levels, and overall metabolic health. Let me explain this with a simple analogy. Think of insulin as a fleet of delivery trucks transporting glucose from your bloodstream into your cells. In a healthy metabolism, the roads are clear, traffic flows smoothly, and every truck reaches its destination on time. With insulin resistance, it's like rush hour traffic after a major accident. The trucks are still moving, but much more slowly. Glucose begins to accumulate in the bloodstream because delivery can't keep up with demand. The pancreas responds by sending even more trucks. In other words, producing even more insulin. Over months and years, this constant overproduction can place tremendous strain on the pancreas. This is one reason endocrinologists focus so heavily on reducing unnecessary glucose spikes, rather than simply lowering blood sugar after the fact. What the research shows is that diets emphasizing minimally processed foods, fiber-rich vegetables, lean proteins, legumes, and whole grains are consistently associated with better glycemic control than diets high in refined starches and rapidly digested carbohydrates. Potatoes can absolutely fit into a healthy eating pattern, but preparation, portion size, and the overall meal matter far more than most people realize. For example, eating a medium potato alongside grilled salmon, roasted broccoli, a large salad, and a drizzle of olive oil creates a very different metabolic response than eating a large serving of mashed potatoes by themselves or alongside refined bread and sugary beverages. The protein slows gastric emptying. The fiber reduces the speed of glucose absorption. Healthy fats improve satiety, helping prevent overeating. This is why nutrition should never be reduced to labeling foods as simply good or bad. Context matters. Your body's physiology matters, and understanding that physiology gives you the power to make smarter decisions instead of following restrictive food rules. If this is helpful so far, consider subscribing. Every day, I share practical, science-based strategies to help you improve metabolic health, support healthy aging, and make informed nutrition choices without relying on fad diets or fear. Let me ask you a simple question. If I placed 4 plates in front of you, a baked potato, a bowl of mashed potatoes, a serving of French fries, and a chilled potato salad, you'd probably say they're all basically the same food. After all, they all started as potatoes. But inside your body, they behave very differently. Here's what's really going on inside your body. When you cook starch, its microscopic structure changes. Heat causes the tightly packed starch granules inside the potato to swell and absorb water in a process called gelatinization. Think of it like unraveling a tightly wound ball of string. Once those starch molecules are loosened, digestive enzymes can access them much more easily, converting them into glucose at a faster rate. Now imagine taking that cooked potato and letting it cool in the refrigerator for several hours. Something remarkable happens. Some of the starch reorganizes into a form called resistant starch. As the name suggests, this type of starch resists digestion in the small intestine. Instead of being rapidly broken down into glucose, part of it travels to the large intestine, where it's fermented by beneficial gut bacteria. Let me explain this with a simple analogy. Picture 2 piles of firewood. One pile is made of tiny, dry sticks. Throw a match on it and it burns almost instantly, producing a quick burst of heat. The other pile is made of thick logs. They burn much more slowly, releasing energy gradually over time. Freshly cooked, fluffy mashed potatoes are more like the dry sticks. Cooled potatoes contain more resistant starch, making them behave a little more like the thick logs. They're not carbohydrate-free by any means, but they generally produce a slower, smaller glucose response. Several clinical studies have shown that cooling cooked potatoes increases resistant starch content and can reduce the blood sugar rise after eating, compared with freshly cooked potatoes. Even reheating them after they've been cooled appears to preserve much of that resistant starch, meaning you don't necessarily have to eat them cold to receive the benefit. But cooking isn't the only factor. Texture matters too. The more processed and broken down a potato becomes, the easier it is for your digestive system to access its starch. Smooth mashed potatoes are digested more quickly than chunky boiled potatoes because much of the work has already been done mechanically. Your digestive enzymes simply finish the job. Then there's frying. Many people assume that because French fries contain fat, they must have less impact on blood sugar. The reality is more complicated. The added fat can slow stomach emptying slightly, delaying the rise in blood sugar. However, frying also dramatically increases the calorie density of the meal and may contribute to greater overall energy intake. Frequent consumption of deep-fried foods has consistently been associated with poorer metabolic health, increased insulin resistance, and a higher risk of type 2 diabetes when compared with diets centered on minimally processed foods. Portion size also deserves attention. A small serving of potatoes enjoyed alongside grilled chicken, fish, beans, and plenty of non-starchy vegetables creates a very different metabolic environment than an oversized restaurant portion that dominates the plate. One strategy I often recommend is following the half-plate rule. Fill half of your dinner plate with colorful, non-starchy vegetables like broccoli, green beans, Brussels sprouts, zucchini, or leafy greens. Reserve 1/4 of the plate for lean protein and the remaining quarter for starches like potatoes or other whole food carbohydrates. This simple visual approach naturally increases fiber, reduces the overall glycemic load of the meal, and supports better satiety without requiring meticulous calorie counting. As an endocrinologist, one of the most common questions I hear is this: why is my blood sugar highest in the morning when I haven't eaten anything all night? At first, that seems to make no sense. You spend 7 or 8 hours asleep without food, so logically, your blood sugar should be lower. Yet many people with insulin resistance, prediabetes, or type 2 diabetes wake up to a fasting glucose reading that's surprisingly high. A large evening serving of potatoes isn't always the cause, but in some people, it can certainly contribute. Here's what's really going on inside your body. Your metabolism doesn't switch off when you go to sleep. In fact, while you're resting, your body is incredibly busy. Your brain continues to use glucose for fuel. Your muscles repair microscopic damage from the day. Hormones are released in carefully timed cycles, and your liver works continuously to keep your blood sugar within a healthy range. Think of your liver as your body's overnight fuel manager. During the day, when you've recently eaten, it stores excess glucose in the form of glycogen. Then, during the night, it gradually releases small amounts of glucose back into the bloodstream, so your brain and other organs continue receiving a steady supply of energy. In a metabolically healthy person, this system is remarkably precise. Insulin gently signals the liver to avoid releasing more glucose than necessary. Blood sugar remains stable throughout the night, allowing the body to focus on repair, immune function, and recovery. But insulin resistance changes this balance. Imagine the liver as a faucet filling a sink. Normally, insulin tells the faucet exactly how much water to release. But when the liver becomes resistant to insulin, it's almost as if the faucet no longer hears the instructions. It continues releasing glucose even when there's already plenty circulating in the bloodstream. Now add a large, high glycemic dinner into the equation. The more I work with patients, the more I notice one recurring pattern. People often ask, should I stop eating potatoes altogether? It's an understandable question. After all, if you've been told that potatoes spike blood sugar, the logical conclusion is to eliminate them completely. But that's not how endocrinology works. The real question isn't, are potatoes bad? The better question is, why is my body struggling to handle them? That's an entirely different conversation. Here's what's really going on inside your body. Imagine two people sitting at the same dinner table. Both eat the exact same meal. 1 medium baked potato, grilled chicken breast, steamed broccoli, and a side salad. One person's blood sugar rises modestly and returns to baseline within 2 hours. The other person's glucose climbs significantly higher and remains elevated for several hours. The potato didn't change. The difference is the metabolism processing it. This is why modern endocrinology increasingly focuses on metabolic flexibility, your body's ability to efficiently switch between using carbohydrates and fat as fuel, while keeping blood sugar within a healthy range. When insulin sensitivity is good, muscle cells eagerly absorb glucose after a meal. The liver stores excess glucose appropriately, and insulin levels quickly return to normal. When insulin resistance develops, that entire system becomes less efficient. Think of your muscle cells as rechargeable batteries. Healthy batteries absorb and store energy easily. But imagine batteries that are already overfilled. No matter how much electricity you send them, they struggle to accept more. That's similar to what happens when muscles become insulin resistant. The glucose is available, the insulin is available, but the cells don't respond efficiently. As a result, more glucose remains circulating in the bloodstream. Over time, the pancreas compensates by producing even more insulin. This condition, called hyperinsulinemia, often develops years before blood sugar levels become high enough to diagnose diabetes. In fact, many people have elevated insulin for a decade or longer, while routine blood tests still appear normal. That's why treating blood sugar alone doesn't address the root cause. The goal should be restoring insulin sensitivity. Research consistently shows that regular physical activity is one of the most powerful ways to improve insulin sensitivity. Resistance training increases muscle mass, providing more storage space for glucose, while aerobic exercise improves the muscle's ability to use glucose efficiently. Even brisk walking after meals has been shown to reduce post-meal glucose excursions. Sleep is another overlooked factor. After just one night of poor sleep, the body's response to insulin becomes less effective. Elevated cortisol and increased sympathetic nervous system activity make it more difficult for glucose to enter the cells. That's one reason chronic sleep deprivation is associated with higher risks of obesity, prediabetes, and type 2 diabetes. Stress also deserves attention. When your brain perceives stress, whether it's emotional, financial, or physical, it releases cortisol and adrenaline. These hormones signal the liver to release additional glucose into the bloodstream, preparing your body for a fight or flight response. That response is incredibly helpful if you're escaping danger. It's far less helpful when you're sitting at a desk answering emails. This explains why some people notice higher glucose readings during periods of chronic stress, even when their diet hasn't changed. Nutrition plays an equally important role. A dietary pattern centered on minimally processed foods, lean proteins, legumes, nuts, seeds, olive oil, colorful vegetables, and adequate fiber supports healthier insulin signaling over time. Fiber slows digestion, nourishes beneficial gut bacteria, and helps reduce large swings in blood sugar after meals. One nutrient worth mentioning is magnesium. Magnesium participates in hundreds of enzymatic reactions throughout the body, including those involved in glucose metabolism and insulin signaling. While supplementation isn't necessary for everyone, people who consume few leafy greens, nuts, seeds, or legumes may benefit from improving their dietary intake after discussing it with their healthcare provider. Vitamin D status may also influence metabolic health in individuals who are deficient, although correcting a deficiency should be viewed as one piece of the puzzle, not a standalone treatment for insulin resistance. This is why I encourage patients to stop thinking in terms of safe foods and dangerous foods. Instead, think about creating a body that can process food efficiently. That means building muscle, sleeping 7 to 9 hours consistently, managing chronic stress, walking after meals, prioritizing protein and fiber, maintaining a healthy waist circumference, and choosing whole, minimally processed foods most of the time. When you improve the health of your metabolism, many foods become easier for your body to handle, including potatoes enjoyed in reasonable portions. If this video has helped you better understand the why behind blood sugar regulation, consider subscribing. Every day, I share evidence-based strategies that simplify complex metabolic science into practical habits you can use immediately. In our final section before the conclusion, I'll give you a complete endocrinologist-approved evening protocol, a simple routine that combines meal timing, food choices, movement, sleep, and recovery to help keep your overnight blood sugar stable while supporting long-term metabolic health and healthy aging. As an endocrinologist, if I could give every patient just one takeaway, it would be this. Your body responds to patterns far more than isolated meals. One potato isn't what determines your long-term metabolic health. One healthy dinner won't reverse years of insulin resistance either. It's the habits you repeat day after day that shape how your hormones, liver, muscles, and pancreas function over time. So let me leave you with a simple evening protocol that brings together everything we've discussed. It's practical, sustainable, and based on the physiology we've explored throughout this video. Here's what's really going on inside your body. From the moment you finish dinner until the time you wake up, your body enters one of its most important repair windows. During these hours, hormones regulate tissue repair, immune function, memory consolidation, and metabolic recovery. The less work your body has to do managing excessive glucose and insulin overnight, the more resources it can devote to these essential processes. Think of your metabolism like the maintenance crew in a large office building. If employees leave behind a huge mess every evening, the crew spends the entire night cleaning instead of repairing what's broken. But if the building is already in good condition, the maintenance team can focus on upgrades instead of damage control. Your body works in much the same way. A balanced evening routine gives your metabolism the opportunity to recover instead of constantly reacting. Here's a protocol I often recommend to patients who want to improve fasting glucose, support healthy weight management, and enhance long-term metabolic health. Step 1. Build your dinner around protein first. Aim for a high-quality protein source, such as fish, skinless poultry, eggs, tofu, Greek yogurt, or legumes. Protein promotes satiety, supports muscle maintenance, and slows the absorption of carbohydrates consumed during the meal. Step 2. Fill at least half of your plate with non-starchy vegetables: broccoli, Brussels sprouts, cauliflower, spinach, kale, zucchini, asparagus, green beans, mushrooms, peppers, and leafy salads provide fiber, vitamins, minerals, and beneficial plant compounds while contributing relatively little to post-meal glucose. These vegetables create volume, helping you feel satisfied without dramatically increasing blood sugar. Step 3. If you enjoy potatoes, eat them strategically. Choose a moderate portion instead of an oversized serving. Whenever practical, cook them ahead of time, allow them to cool, and then reheat them if desired. This simple practice increases resistant starch, which may modestly reduce the post-meal glucose response. Even more importantly, never let the potato become the largest component of the meal. Treat it as one part of a balanced plate rather than the foundation of dinner. Step 4. Slow down while you eat. Your digestive hormones need time to communicate with your brain. Eating quickly often leads to consuming more food before fullness signals arrive. Chewing thoroughly and eating mindfully can improve satiety and may reduce overall calorie intake without requiring conscious restriction. Step 5. Move gently after dinner. This may be one of the most powerful and most overlooked strategies in metabolic health. You don't need an intense workout. A comfortable 10 to 20 minute walk after your evening meal encourages your muscles to absorb circulating glucose, reducing the demand on insulin and improving post-meal glucose control. If outdoor walking isn't possible, walking indoors, climbing a few flights of stairs, or performing light household activities can also help. Step 6. Protect your sleep. Sleep is one of the body's most effective metabolic therapies. Aim for 7 to 9 hours of consistent, high-quality sleep by keeping a regular bedtime, reducing bright light exposure in the hour before bed, limiting late-night caffeine, and creating a cool, quiet sleeping environment. Remember, even an excellent dinner cannot fully compensate for chronic sleep deprivation. Finally, don't chase perfection. There will be birthdays, holidays, vacations, and family gatherings. Enjoy them. Long-term health isn't built by avoiding every carbohydrate or fearing every potato. It's built by making thoughtful choices most of the time. When you consistently support insulin sensitivity through nutrition, movement, stress management, muscle-building exercise, and restorative sleep, your body becomes far more resilient. And that's the real goal, not simply lowering one blood sugar reading, but creating a metabolism that works efficiently for decades to come. That brings us to the end of today's discussion. We've learned that not all vegetables influence blood sugar in the same way, and potatoes are a perfect example of why context matters. It's not just the food itself, but the portion, preparation, timing, and the metabolic health of the person eating it that determine the response. We explored how potatoes are rich in starch, how cooking and cooling can change their impact through resistant starch formation, why late evening high carbohydrate meals may contribute to higher fasting glucose in people with insulin resistance, and why the real issue is often impaired insulin sensitivity rather than a single food. Most importantly, we've shifted the focus away from fear and toward physiology. Your liver, pancreas, muscles, hormones, sleep, stress levels, and daily habits all work together to regulate blood sugar. When you understand that system, you stop chasing quick fixes and start building lasting metabolic health. So here's my challenge for you. Choose just one strategy from today's video and practice it consistently over the next 7 days. Maybe it's taking a 15-minute walk after dinner. Maybe it's replacing half your dinner plate with colorful, non-starchy vegetables. Maybe it's preparing your potatoes ahead of time and pairing them with lean protein instead of eating them on their own. Don't try to change everything overnight. Small, consistent improvements often produce the greatest long-term results. Pay attention to how you feel. Notice your energy, your hunger levels, your sleep, and if you monitor it, your blood sugar. Your body provides valuable feedback when you give it the right environment to thrive. If you found this video helpful, please take a moment to like it and share it with someone who is trying to improve their blood sugar or metabolic health naturally. And if you haven't already, subscribe and turn on notifications. Every week, I share science-based, practical strategies to help you understand your body, improve your health, and support healthy aging without relying on fad diets or unnecessary fear. Thank you so much for watching. I appreciate you spending this time with me, and I look forward to seeing you in the next video. Until then, take care of yourself, stay curious, and remember, the healthiest changes are the ones you can sustain for a lifetime.